Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamu alaikum.
Assalamu alaikum to everyone who is watching us out there. Today happens to be 22nd of May. It is the World Biodiversity Day, and we've always been talking, and yesterday we were also talking about how climatic conditions are personally impacting us. This is coming from a very personal tone because we in Pakistan, we are prone and very vulnerable to all of these fallacies that we experience in the climate.
Now coming towards, a very important topic, and it's because of the fact that imagine, me and Hajra, we would always speak about how everybody needs to go get themselves tested at least once a year or twice a year. And that's one thing which is not really very common over here in our country, unfortunately, because of the fact that people think, what if kuch nikal aaya to kya ho jayega? Something of that sort as well.
Or generally you would experience that people are very lax when it comes to their health. They're like, okay, we are doing fine, and unless we experience some symptoms, then we are going to get ourselves checked. But I think it's become essentially important after the 40s that you once a year you get your health check. And when Shahzad mentioned about the World Biodiversity Day, and when he mentioned the health of the environment, it's all interconnected, it's all linked, right? So your health is also impacting the health of your environment.
True.
So particularly, and when we talk about the organ donations, and in Pakistan we've seen that there were some resistance that were propping up, especially by the religious segments, by the particularly the religious mores or the norms that people used to uphold, and they talked about that how it's not prohibited, it's prohibited, right?
Yep.
So we are going to bust all of these myths regarding that, because we do have fatwas where it is permissible to donate your organ, especially when we talk about when people are suffering because of that. And to further delve into the story, because we have a very inspirational story and the transformative power of that particular story, where a person, a sister who happened to donate her kidney to another sister, so how that changed her, how that transformed her, and not just that, and how he earned a lot of sawab because of that.
And it takes a lot of courage as well. Now imagine that, unfortunately, if somebody is already struggling to live or to sustain or just to be alive, ladies and gentlemen, imagine that, if they need an organ and if they're in dire need of it. Now imagine that, most of the times I've seen, in a recent incident, what I've seen is that there was this one father, who was in need for a kidney, and the kids didn't really show up. And they were like, unfortunately, I'm very sorry to kind of come across such a story as well, where the children were like, hey, you know what, the father has already lived his life, we'll look for somebody else, and that's illegal in the country, so that can't really happen as well. Now imagine for this sister to stand up for her own sister and say, hey, you know what, I'm going to donate my kidney to you, is something which is going to be a very inspirational story for everybody to listen, to learn, and how it has had impact on her life. And do you think that, unfortunately for people where there's so many myths around kidney transplants, you can see the pictures of these sisters as well, so it's somewhere in the United States of America, where one sister actually kind of thought of saving the life of her own sister by donating a kidney, not thinking about what the impacts or the repercussions are going to be. And today, ladies and gentlemen, it's the day where we will be talking about it. Not just that. Now imagine that this initiative actually kind of pushed her to actually have her own non-profit organization registered, and to kind of raise awareness about kidney treatments, illnesses, whatever diseases that it encounters as well. And not just that, she's trying to build a dialysis center over here in Sohava. How is she doing it? How is her health? How is her sister's health? Is something we will be talking about. We're very lucky that we've actually been joined by somebody who happens to be Miss Naima Khan, happens to be the founder of Voices for Kidney Patients. Hello, assalamu alaikum, good morning. How are you doing today?
Walaikum assalam. It's a privilege to be here. Thank you so much.
Thank you so much for joining us.
Naima,
It's our privilege that you are here as
Right.
well, and it's an honor for us because you'll be inspiring a lot of people today, and you happen to be a hero for all of us for
Thank you so
doing
much.
what you've done and what you will continue to do so far for the illnesses, treatments, and early detection of kidney illnesses.
And Naima, why don't you delve into your own story and please tell out the audiences, so how did your journey started, and why did you took up this particular advocacy for the kidney patients?
So my story is very passionate. I'm about. It's something that I'm very close to. When my sister Aisha, she was suffered with the kidney disease for about 22 years.
Okay.
So in 2017, when she was approved for the transplant, and I became to be her match, and then I donated her kidney, and then this is when our life's perspective changed.
Did you really think about it when you got to know that, okay, now she can actually get her transplant done, and then you became the match as well, because obviously there's a lot of testing which goes into it,
Yes.
and they finally told you, Naima, okay, you can donate your
Yes,
kidney.
so-
Did you really think about it, how it's going to impact your life, or how you were putting your life in danger as well?
Not not that much that I thought about it. I mean, when she was approved for the kidney transplant, so they first start with the matching, like the family members have to come up, and then they have to go through all the the tissue matching, the blood matching. So I was the one who was the perfect match according to the doctors, that I am the closest and the perfect match.
And what's the sort of advices that you were getting from your parents, from your family members, from your friends?
Well, they were obviously, my parents were very worried because they see the one daughter is already sick, and then another daughter is always like the risk factors involved when you go for the organ donation. So my parents were involved, but I had the blind faith of Allah Subhanahu wa Taala that everything is planned and it's going to go according to the His plan, and I shouldn't be scared of it.
And when we talk about particularly your journey and how it transformed you, and when you talk about how you want to inspire a change inside the Pakistan. So we have seen, Shahzad, particularly a few years ago, Pakistan had a very black market when we talk about the kidney donations, and how there are a lot of people who were selling in very minimal amounts,
organ
right?
donation in general
Yes,
as well.
yes. And I think kidney donation particularly standard out because government massively cracked down on those particular elements in the black market, right? So when you talk about the advocacy here in Pakistan, what are the challenges that you are facing as of right now, and what are some of the missing gaps that you identified?
The first thing I see is that if we started off, it's a prevention. Like I met with few doctors, few nephrologists here, and then they told me that we have to start out with the prevention.
Right.
If we're talking about the organ donations, there's a huge misconception here in Pakistan. They think that one kidney, if I'm the donor, I can never have kids. I can get sick, and what's going to happen to me? What if I'm going to get up to a dialysis? So there are so much misconceptions in here.
And that's what I would want to speak about in particular as well. So 2017, the transplant takes place. Alhamdulillah, your sister's healthy, you're healthy.
Yes.
People can see that as evidence as well. How was the journey, when we talk about the recovery from the transplant, for somebody who's been donated an organ, and for somebody who herself has given an organ?
So for my sister's point of view, she's my recipient. So they have a different, the treatment, because they get a donor. I mean, they have the organ that's not her.
Yeah.
So she has to take immunosuppressive, suppressive medications, and then they have to be extra careful, because for her, she can easily can catch the viruses.
Exactly. And how is she now?
She's doing well. She's compared to her. I mean, I remember the day when she got my kidney, and the doctor's team came to her and then told her, you can eat anything you want. You can drink water as much you want. I remember her words, that how much she cried that moment. And I still, thought about it, that why does she have to cry? I mean, she can drink water, but then I realized that when you are on the dialysis, you cannot have the water. You have to have a certain amount of water. You cannot eat too much. The food is very limited for the kidney patients. She's coming from the way where she has experienced the patients who are under dialysis.
And what's her name though?
Aisha Khan.
So Aisha, if you're listening to us, today, so we certainly are talking about you over here, and we thank Allah Almighty that that you live to share your story, and your sister over here is kind of letting us know how much of struggle that you had to go through, and shukr alhamdulillah. And for all of those people out there, I guess that today's program is going to open more avenues for people to kind of think about it, because if you are going to have a match, in terms of organ donation, I think that's something which is beautiful, and your siblings can live and continue to live.
And I think, I'm pretty sure that must be a very emotional and sentimental point or moment for her in her life, because when you are deprived of some things that as we common person take for granted a lot, we can't understand the struggle that another person is going on, which is deprived from that nemat of Allah, right? So Aisha, Ms. Naima, you are particularly focused on having a dialysis center in Sohawa. So why did you selected Sohawa as a place? I mean, did your research about the demographics of the area? Are they in need of that particular dialysis center? So why is a particular focus in opening that center in Sohawa?
I would say, the journey that we've been through, it's a miracle.
True.
Right? It's a miracle, how the small organ can transform the life. And then I came to Pakistan. It was my vacation trip to visit my childhood friend Anjum, and nothing was planned. Everything was unplanned. And I was just stuck at some political rally at that time, and then I just in my mind had thoughts like, you know, what happened if there is a dialysis patient, you know, how far, you know, he would go for the treatment. This is where in Gujarat I was at the dialysis center. It's owned by Raja Said Saab. He opened its doors for me to go meet patients and to learn about it. It was just for my visit to just learn about how the system works here. And then when I met those patients, I remember there was only one girl, like 13-year-old Kasha Fatima, and I was very surprised that, you know, how come the dialysis patients, all age group, can be treated in the one center, because in the United States, you have a pediatric dialysis center separate, and then you have the adults dialysis center. So that was something that I remember. And then I went back, and I was not in my peace. I mean, my heart was kept saying there's something wrong about it. I have to do something. I mean, it was my vacation trip. I shouldn't be get bothered, you know. But then when I back, I just learned all about the dialysis system, how basically, because when my sister was under dialysis, I never thought about it, you know.
So then you registered, you know, because you happen to be a founder of Voices for Kidney Patients, you know. It's a registered NGO in US, and it's working globally. And so, you know, how did this came into being as well, that now Naima is going to be the founder of Voices for Kidney Patients?
Right. So when I was studying, I applied for the DaVita Health Care Kidney. It's a world leading kidney center for the dialysis patients. I worked there. I got their DaVita, you know, PCT technician certified. So I learned all the system just to get the basic understanding. Then I was like, okay, I need a platform to help people, and this is where I discussed with my sister, and we both decided, okay, we have to form an organization, and that can be the, you know, the platform for all of them. And then for the name Voices, these are all the voices that were in my head when I visit the dialysis center in Pakistan.
And now, what's the purpose that you're serving under the umbrella of Voices for Kidney Patients?
So with this, we are spreading awareness about the kidney health, about the kidney disease, the lack of, you know, the communication. What I have studied so far, that there is no nephrologist that's available in the remote areas. If we talk about the Gujarat and its surrounding, you know, areas
so
that covers the
Sohawa.
Yes, so I understand their frustration. I mean, the transportation they have to pay out of pocket, and then the dialysis patient, they have to pay, you know, if they are on the 3 times in a weekly treatment, each treatment is up to like 1,000 to, you know, 3,000 rupees. And these are all patients are underprivileged. They all need financial support. This is something that I was like, we need to do something about it. You know, there has to have another dialysis system. There has to have a pediatric dialysis system. Some of the patients don't even go to nephrologists. They sometimes skip their dialysis because they think that it's too much out of a pocket. I mean, there are other dialysis centers who are supporting. You know, they don't charge. Like this is where I want to mention the, you know, Asif Rabbani Qureshi Sahab dialysis center it's in the Kahura. It's one of the art of the dialysis center that I would say that doing its fantastic jobs. I mean, they are, you know, free of cost treatment. They have the labs.
I think we do have visuals from there.
Are these the visuals from
that?
Yes, this is where I visited, and the reason I say it's a art, you know, of the dialysis center is because the model they have is similar to the model that I have worked at the DaVita.
So they have a different department for adults and then different departments for pediatrics?
What I have seen that the upper floor, they try to, you know, take the, you know, the pediatric patients, and the down floor they have the adults.
And why do you think that there needs to be distinction in between both these departments as well? You know, do you think that the needs are different?
Because of the psychological factors, and because of the dialyzers, they have a different, you know, when you go to the dialysis treatment, you have an adult as a different set of mind. And when
anatomy
you go,
is also different, right?
Yes, it makes a great impact, and I think it needs to be done in all dialysis centers.
So now where are we? You know, so in terms of Sohawa, where are we, you know, with the dialysis center that you want to establish? And now meanwhile, while you're thinking or planning to establish that department, are you helping other people over here in Pakistan in rural areas to get their dialysis done for free, you know, transportation? How's it going?
Right now, I would say there are a few patients, I would say like, you know, 5 to 7 patients that we have been taking care of to, you know, do their medical treatments. I just recently, you know, arranged a transport system that takes them from there to the Bahariya hospital, because they go to Dr. Mazam for their checkup. So that's something that I'm doing on from my side. And then there's also a greater need for the dialysis technicians, nephrologists, nurses. So I'm in the initiative planning to launch dialysis technician programs to educate this, the girls, college girls. So
and how's the advocacy going so far? Have you been to the colleges? Have you been to schools?
Yes, I have been to Darul Arqam College, that's on the GT Road,
Yes,
and
yes.
Professor Bukhari Saab has been very, supportive. He opened his college door that if I'm willing to start a program here, he is all the way up, to lead this program, because it's something very required. I mean, if you can build a dialysis centers and you don't have a professional certified technicians, if you don't have a certified nurses, there's no point. So we have to have education, both sides, from the technicians from the medical perspective, as well as from the patient's perspective.
And how do you intend to execute your program of the Sohawa? Because you've talked about the technicians and support, and when it comes to donations, so what are your technicalities and modalities that are involved? I'm pretty sure it's a big project, and
Yes.
you require a lot of other stakeholders in this project. So so far, what are the challenges that are propping up in your journey?
So since my sister's organization is registered in USA, we have a greater support. I mean, our donors are all US supporters.
Right.
When it comes to financially, getting all the help. In Pakistan, there is, we're doing our awareness programs, and it just happened to be 2 days back I had an opportunity. It was like a privilege to meet Raja
Pervez former Prime Minister, yes.
and then former Prime Minister, to introduce him what I'm exactly working on, and he is very interested because Sohawa and all that area is his hometown.
Constituency, yes.
So he is interested and he is willing to support me. So right now in Pakistan, I'm going through with some registration process, the procedure that I have to respect and go through all the way legal way. I want to have it work on it when everything is compatible over here and also compatible with my NGO.
Exactly. Well, that's wonderful. And in addition to this, where you actually spoke about Raja Pervez Ashraf Saab as well, and how he's going to be helpful in his own constituency. Do you think, because where Hajra actually spoke about the demographics, whether you're well aware of where, it is needed most, or is it because of the fact that, because you belong to Sohawa, so that's why you've thought about Sohawa, that, okay, I'm going to have the first center over there, number one. And number two, when we talk about the donors, because it's a non-profit organization based in United States of America, what sort of donors do you have over there? And do you think that, that you need more people to show up and can kind of help you in this cause? And where can they contact you? How can they reach out?
So we have our website. I also have my Pakistan, the contact number in here. My personal email address is here. This is where they can contact me.
So if you want to give away your email address, I guess today is the right time and place to give it away.
Sure, it's info@vfkp.org.
So it's info@vfkp.org. VFKP Voices for Kidney Patients, ladies and gentlemen. So please make sure that you reach out to her as well for anybody who wants to donate. I think that her ambitions are greater than anything else as of now as well. And just very quickly, I think, ladies and gentlemen, I think I would love to thank you as well. So thank you so much for joining us. It was wonderful to have you.
Thank you
We're
so
lovely
much.
with you and for all of us. And for everybody who's out there, ladies and gentlemen, heading out towards the short break, because you guys will come back. Youngsters are doing a great job as well. At what? That's something we will figure out after a short break. Good morning.